So thank you everybody for coming today. This is your lunch, live and learn experience. I am your host, Paul Michael Despres. I'm in my last year at Bastyr, so 505. I'm an ND candidate and hopefully graduate in June. I had the opportunity last February to go to New York City to go to the Integrative Healthcare Symposium. And this is kind of my PowerPoint of one of the main key themes of the weekend was gut health, and especially like resolving gut dysbiosis and the relationship of microbiome, microbiota to our overall health. So just to let you know, the MDs who graduated and didn't have much training at all in microbiome and health, they're really into it now. And so we should feel very lucky that we're getting it in our education, because I feel like we all are. Like we graduate, we're kind of ahead of the curve of where like the alternative complementary MDs are now heading, especially in the functional medicine realm. So I'm going to kind of power through this PowerPoint the best I can. If you have questions, let me know, or else we can take this outside afterwards and have like a better discussion in the sunshine and nurture ourselves in vitamin D. So like I said, the healthcare symposium was the end of February, and this was cool because I had a bunch of medical doctors. There was MDs, there were RDs, there were nurses, there were PhD people. And here's just kind of a list of some of the speakers. There was Jeffrey Bland was there, and Mark Hyman were probably two of my more favorite presentations. I'm happy to give you all the PowerPoints that I had from that weekend. And yeah. So like I said, there's a heavy focus on functional health, gut health, epigenetics, lifestyle changes, and nutrition. And it's kind of a personal interest of mine as well, so that aligned really well with this presentation. So just some general background definitions. You probably already know this. But it's good to kind of revisit once in a while. Dysbiosis is basically a microbial imbalance in the human organism. Now this can occur in many places. Typically we think of it in the gut. It also can happen in the mouth, the respiratory tract, the GU tract, which often you notice like chronic UTIs, and even the skin, so like chronic infections related to the skin. The microbiota refers to the cumulative census of which microbes are actually in that particular area, whereas the genome, or the microbiome, refers to their collective gene pool of all those microbes. And for this presentation, I'm going to primarily focus on gut dysbiosis, but I think there's a lot of parallels between gut dysbiosis and treating like the respiratory tract and the GU tract. I don't really dive into like topicals that you can take potentially for skin for resolving a dysbiosis in the skin, but intuitively you might be able to think of some stuff yourself based on the presentation as well. And also SIBO, who here is familiar with SIBO? Okay. Yeah, so SIBO is just small intestinal bacterial overgrowth. And the way I picture it is just it's dysbiosis even higher up, which a lot of the symptoms people have are like gas and bloating, a lot of abdominal pain. And it's managed a little bit differently, but overall the same. As far as why we want to focus on dysbiosis and like how the hell does it cause disease, well, we're fairly well versed in knowing that like 90%, they say 90% of our immune system surrounds our GI tract, right? So the health and the well-being of microbes often correlates with like abnormal immune reactions, and these kind of take place through like molecular mimicry, immune activation, eventually downstream immune complex formation and deposition in terms of like rheumatoid arthritis. Damage to the mucosa of the intestines, it kind of leads to like the leaky gut, food sensitivity, celiac disease, picture, alteration of detoxification, and even their endotoxins can cause disease. And this can either lead to local inflammation right there in the intestines, or it can be more systemic, in terms of inflamed joints, yada yada. But in order for them to cause disease, Dr. Vasquez, who writes an immense, large, thick book on like functional medicine, views that the host has to have some type of immunocompromised situation and also maybe be predisposed to it genetically. But we're learning more and more that genetics is basically epigenetics. So like we're born with what we have, but our environment, our lifestyle, our thoughts, our stress, our childhood upbringing really influence the expression of those genes. And then proposed causes of the dysbiosis itself. Like I kind of just said, a lot of it, it's like the epigenetics, which I consider lifestyle to be kind of epigenetics. I'm not sure if there's direct evidence of like you eat a cheeseburger and like a certain gene comes on and then you're like predisposed to be obese. That's just not there that I know. But just generally speaking, we know epigenetics does play a role, and even early lifehood experiences such as birth in hospitals, like a C-section, a baby doesn't have interaction like the normal vaginal flora that might predispose a child to have diseases down the road. And certain, of course, medical practices like overuse of antibiotics, can predispose somebody to have an abnormal flora because you're just wiping out the flora all the time, and then you might get some bacteria in there that can kind of overtake like the normal healthy bacteria. And then, of course, it gets into immunology, Dr. Wenner, Th1, Th2 increase, and that's kind of, I won't get into that, but if you have questions about Th1, Th2, we can talk about that later. So as far as what diseases it might present as, it kind of varies. You can have gastrointestinal complaints, of course, so like the IBD, IBSs, celiac, like recurrent infections like C. diff. But there is some association with potential like colorectal cancer and gastric cancer. And then of course any autoimmune condition, so like your lupus, your arthritis, rheumatoid arthritis, all those like rheumatologic autoimmune conditions, we often look to like a anti-dysbiosis protocol to help resolve those. And fibromyalgia is also a large one. There was a presentation on fibromyalgia at the conference, which, that PowerPoint. So resolving gut dysbiosis, what do we do? So we can eat fermented foods, which is helpful. We're passing those around. Yeah, and but there's a little bit more than that. So I was trying to think of an acronym, and for some reason I thought of like when you get on fire, like the stop, drop, and roll acronym. So I was like, you gotta stop the dysbiosis. You gotta drop in the determinants in terms of like diet, health, and then you gotta roll in the new bacteria. You can laugh and they can record it. Yeah. Okay. So all right, so. But it's actually 5 steps. That's stop, drop, and roll, but there's actually 5 steps. And we'll walk through these briefly, but first of all, we need to assess for gut dysbiosis, make sure it's indicated, and then we do some type of eradication or wiping out the flora. It's kind of like making a clean slate. And potentially if there's improvement in symptoms or improvement in like the testing that we did confirming dysbiosis, then we move on to reestablishing proper GI function, and that would be like diet and probiotics, and different nutrients and like stress reduction and yada yada. I'll get to that. Eventually, we do much more repopulation with healthy flora in terms of probiotics. Like which probiotics should I use? How many billion do I need? There is some evidence of that, and we'll kind of explore that when we get there. And then this very small down here, determinants of the health. I think that should actually be step A. This is my own bias as a naturopath. I really feel like we should start with the determinants of health pretty much always. Sometimes if somebody's having an acute presentation or severe symptoms, you need to get that under control first. But like determinants is where it's at, people. Get on board if you're not on board. Like join me. Join the revolution. Feel the burn of the determinants. Any questions so far? All right, great. So yeah, like step one, you got to assess for gut dysbiosis. Now this can be done using like lab testing. You know, we can do different tests of the stool. We can do some aspirations. We can go into your intestines and like take a sample, or you could just base your assessment on empirical data. So in terms of like their subjective symptoms, you know, what you see objectively also. And based on that and based on their history, you presume they have gut dysbiosis, and then you treat them presumptively. And then based on if they respond to treatment, that might confirm or disprove your working diagnosis of dysbiosis. If it's SIBO, you know, we often do the breath test. We're testing for hydrogen and methane positive results there. It gives us an idea of how severe an overgrowth might be in the intestines. But more or less, we just need to figure out, is it indicated? And that's step one. Step two is eradication. So eradication can be done multiple ways. My preference, my bias, would be to try like antimicrobial first in terms of botanical. And often we see berberine mentioned a lot. And that can be about 500 milligrams 2 to 3 times a day. You can couple it with oregano oil as well. And often you do treat for like 3 to 6 months. And sometimes you do repeat the treatment later if like the symptoms return. And you could explore some medications. The duration of treatment would be much, much less. Rifaximin is commonly used. And rifaximin is an antibiotic. It's nice because it's local. So you take it and it just stays like right in the GI tract. So it doesn't have any like systemic effects of like antibiotics. Like it's not absorbed. And then if you did a SIBO test and they were positive for methane, you might couple it with neomycin to get even larger, more broad medication. And then adjunctive support, like peppermint oil is good for like bacteria die-off. So let's say I prescribe berberine and I have a lot of gas through the process. Peppermint oil can help like knock down some of that flatulence they're experiencing. And acacia fiber just to prevent constipation. So don't forget, you know, like all our naturopathic adjunctive care support that you already know, you can still use that, you know, to help somebody manage through the process. Step 3, after you do this treatment for a while, you want to have an idea of, did it work? You know, should I repeat treatment or should I move on to more like diet lifestyle determinants and try to reestablish? Yes.
I actually have a question about the last slide.
Yeah.
Do you know if there's a reason for using rifaximin or neomycin? I'm not familiar with the pharmaceuticals. I know berberine and oregano oil will leave alone the normal flora. There's some studies out there to show that. Is there anything like that to go along with the two?
I don't think rifaximin, I've never heard of rifaximin being as selective.
Gotcha.
Berberine.
Okay.
So that could be one of the added benefits of berberine, in addition to like kind of helping the tight junctions. I've heard about berberine. Just sometimes people don't respond to berberine. Like you might do a botanical treatment for whatever, a couple months, and like it just doesn't seem to be helping, you know, or makes symptoms much, much worse.
Mm-hmm.
So this isn't really an exact science. You can kind of jump around to like, well, maybe I would try some botanical for a couple weeks. If botanical's really working, then we might try rifaximin. It just gives the patient more options, I guess. And there's also cost. So rifaximin typically isn't covered by insurance. So it can be pretty costly. Berberine, of course, isn't because it's just a supplement. So like, how do they compare? You know, you gotta kind of do your research. And I found it to be fairly comparable in price to people that I've seen. Yeah.
How soon would you expect to see clearance of symptoms to know that you were on the right track with the treatment?
Good question. It's going to vary per patient. I would anticipate improvement symptoms by like 2 weeks. but some people it could take a little bit longer, or it could be like a couple days. You know, like some people notice it right away. And with berberine, there is some chance of like diarrhea, gastrointestinal upset, but that normally normalizes like after a week. So like let's say you put somebody on berberine and then they notice much more loose stools, you kind of want to stick with it. Maybe just do like some constant or some diarrhea support, but that should normalize.
And where would you expect die-off to be in that timeline? Could it be like concentrated and really bad at like 3 weeks and then clear up, or is it just going to be really variable?
I don't think there's clear evidence of where like die-off occurs in terms of like the graph, you know? And just to be clear, like I'm a student. I've treated more SIBO people in our clinic than I have dysbiosis patients, and it's really variable. And this isn't really an exact science. I hope that's clear. Like this isn't an exact science. This is kind of based on like anecdotal evidence that some practitioners have done and some loose research, and a lot of assumptions of like how botanicals work and how it should affect the person. So always use like your clinical judgment, do your due diligence to investigate the research yourself. This is taking longer than I thought. I thought it'd be outside right now. So step 3, to determine if there has been an adequate die-off, if it's time to move on to more determinants of health. Some people you repeat eradication step for the same treatment, or you explore other ones, kind of what we were talking earlier, John. Reestablishing proper GI function would be the next step. Usually, there's a pretty unanimous agreement that you want some type of prokinetic. Because why the heck did they have dysbiosis in the first place? Well, maybe they had it because they were having slow transit time, of the intestines. They had predisposed stuff to kind of just sit in there and hang out, and then dysbiosis to happen. So if you do all the wiping out, and then they still have a very slow movement of their intestines, then it's just going to come right back. So it's often good to do a prokinetic, and we all love bitters, but these are some other formulas that you can do. And some people even do low-dose erythromycin. It acts more as a prokinetic than an antibiotic. Also determine, do they need any digestive enzymes or acid, which also could be a reason why they have dysbiosis in the first place, low stomach acids, just kind of overgrowing. And then diet, a lot of the diets that people explore, low FODMAP is pretty popular in GAPS. I seem to view it just emphasizing fruits and veggies, nuts and seeds and berries, like a very diverse diet that's high in, high in fiber and high in fermented foods. And you can even add in prebiotic foods such as burdock root, bananas. And some people like to do some glutamine foods, and ghee or coconut oil can help with healing of the intestines as well. And then other things to support proper GI function, you could do supplements, so you could do multivitamin, glutamine itself. Probably the one that I would do the most would probably fatty acids. And then if they aren't getting an adequate diverse diet, add a multivitamin or multimineral. And vitamin D3 if you feel it's indicated, especially in the winter. Drink your water. Avoid bad drugs that might cause things like PPIs, would predispose you for dysbiosis. Get moving, sleep, reduce stress, and brush your teeth and floss. I decided to speed through that slide. Any questions? Okay. So you'll get different views. I've heard from certain professors, I've seen certain books, and even people at the symposium, when do you reintroduce a capsule of probiotics? Dr. Bennett here at Bastyr seems to believe you don't want to reintroduce after the eradication phase. Some people say you do it right after the eradication phase. I'm not exactly sure. I haven't had a chance to explore it on the clinic. So it kind of leaves it up to your discretion. I believe Dr. Vasquez likes to do it much later after eradication as well. So just to be safe, to kind of do both worlds, if you just really push the fermented foods after the eradication phase, there can be some natural restorative flora that way instead of supplements. But whether that or this, like eventually you will have to add some of these probiotics back into add probiotics to replenish the flora. And there was a presenter at the symposium, and I couldn't find her dang research study, but she suggested actually 5 billion was the best amount. Like when you get higher, it actually might predispose you for dysbiosis. If anybody finds that, email me, paul.debray@bastyr.edu. I could find it. So I think that just brings up a good point. No, we're not exactly sure how many billion we need, like how often we need to take it, even what strain. But if we just kind of do like a broad spectrum probiotic, could be helpful. Saccharomyces is probably one that's most studied. It's helpful for the IgA levels. But these are some other ones that have been there's some research papers on those. Bifidobacterium breve, is shown to modulate like Treg cells. So yeah, it's not exactly clear, but this is like the best we have to work off of right now. So yeah, just some lasting reminders. Always start with the determinants of health. We're naturopaths. And make sure it's indicated. Because if you go down this road of doing a dysbiosis protocol with somebody, it's expensive, it's time consuming, you're throwing on a diagnosis, they're like, well, maybe something's wrong with my gut. So then like there's some psychological stuff that might be associated with that. It's just a long road, and just, do your work, do your research, make sure you want to take them down this road. And maybe you don't even have to do like a protocol that's this crazy and intensive. Maybe just doing like some berberine for a while might be helpful, and then just improving their diet and then probiotics. Kind of leave that up to your own discretion. This protocol is based on what I've read, what I've seen in lectures, but I'm always cautious, and I want to encourage people to keep an open mind and explore things themselves. And also, like with anything, you'll learn this in the clinic. They want to know like how long you're going to be on it, and what's your expected outcome. Like to have like a timeline, and not just kind of do this loosey-goosey, like we're going to be on this for a while. It's good to have things kind of more clear cut. And the presenter that I saw, she said you can't resolve dysbiosis by simply supplementing probiotics. It needs to be a more extensive protocol than that. Thank you for coming. Cues. Or you can clap first.
I have a question, but I mean, I could wait until we go outside.
Do you guys want to go outside? Yeah. So yeah. Yeah. Okay. Well, special thanks to my teachers. This is the book I was citing, Inflammation Mastery, by Dr. Vasquez, and yeah.
Is that Dr. Blum or Bloom?
Bloom.
Bloom? Renee Bloom? Is she a naturopath?
She's not a naturopath. She's an MD.
Different one.
Yeah, she wrote a book, and her protocol is very similar to this one. Yeah. Okay. Well, let's close this up and go inside. What do you guys think of the Nutrient?